A sudden onset of neck pain or stiffness is actually quite common. In fact, 2 out of 3 of us will suffer from it at some point in our lifetime. Now, I know it's a pain, but the good news is that neck pain usually lasts a couple of weeks, and there are also many things that you can do at home to help with this. So what are we waiting for? Let's begin. Okay, so in most cases, neck pain is not usually due to a serious condition or a neck problem. In most cases, quite often, the cause is actually unknown, and we call this non-specific neck pain. Now, it might be caused by bad posture, sleeping awkwardly, a pinched nerve, a neck injury, and potentially many other reasons too. However, please remember, if your neck pain or neck stiffness doesn't go away after a few weeks, painkillers haven't helped it, or you're just worried about it, or if you have any of the following symptoms like tingling, prickling, numbness sensation, or if your arm has gone cold or your arm and hands have become weak, then you need to speak to your doctor as soon as possible. I will leave a full list in the description below for you as well. So how can you ease the neck pain or stiffness yourself? Well, the first thing that you should do is try either a heat or a cold pack on the area of the neck that hurts. So option 1, get a hot water bottle, wrap it in a tea towel and place it on the area that hurts for about 20 minutes, 2 to 3 times a day. Please be very careful though that you don't burn yourself. Or option 2, grab yourself a pack of frozen vegetables like frozen peas. And before anyone comments, I know that peas aren't technically vegetables, but we do refer to them as vegetables. So grab yourself a pack of frozen peas, wrap it in a tea towel and place it on the area for about 5 minutes, 2 to 3 times a day. It's really important that you do wrap it in a tea towel, please. So that's a few simple things that you can do that are going to help. But the next thing that I recommend to all patients are these 4 simple exercises that everyone can do at home. And I know what you're thinking right now. You're probably thinking, but Abraham, you must be joking. My neck is so painful and stiff. I can barely move it. And I get that. I've been there. But please remember, bed rest for more than a couple of days is going to make it harder for you to get back to your normal routine. And by doing these exercises, it's going to help with the pain. It's going to help you recover. So what are we waiting for? Okay, so let's begin with the neck tilt exercise. So tilt your head down and rest your chin on your chest. Now gently tense your neck muscles and hold this for 5 seconds. Then return back to your neutral position. You need to try and repeat this 5 times. Next up, we have the side-to-side neck tilt. So tilt your head down towards your shoulder, leading with your ear. Now gently tense your neck muscles and hold this for 5 seconds, then return your head to the center and repeat on the opposite side. Repeat this 5 times on each side. We're now past the halfway mark, so next up we have neck turns. In this exercise, turn your head towards one side, keeping your chin at the same height and moving within comfortable limits. Now gently tense your neck muscles and hold for 5 seconds, then return your head to the center and repeat on the opposite side. Once again, you need to try and repeat this 5 times on each side. And lastly, we have the neck stretch. So keeping the rest of the body straight, push your chin forward so your throat is stretched. Now gently tense your neck muscles and hold for 5 seconds. Then return your head to the center and push it backwards, keeping your chin up. You also need to hold this for 5 seconds. Repeat this exercise 5 times. So as I mentioned at the start of the video, most cases of neck pain, the cause is unclear, and we call that non-specific neck pain. So for non-specific neck pain, these exercises should help ease the pain within 2 weeks, and hopefully after 4 to 6 weeks, you should be fully recovered. Now please remember, try and do these exercises for 6 to 8 weeks in total, and this will help to strengthen the area too, and hopefully prevent the neck pain from coming back. Now please remember that if your symptoms aren't improving, then you should definitely make an appointment to speak to your healthcare professional. I explained it right at the start of the video and I'll say it again. I'll leave a full list in the description below on when you should speak to your healthcare professional, and I'd highly recommend everyone reads it. So your next question might be, well Abraham, what other options do we have for neck pain or neck stiffness? Well, another option would be painkillers. These are quite effective for the neck pain or stiffness, such as paracetamol or ibuprofen, but please always speak to your pharmacist first before you take any medication so they can check that you're safe and suitable to use that medication, and also always read the medication leaflet that comes with any medicine. Another useful tip is to use a low firm pillow, as quite often larger pillows can cause neck pain and stiffness. Also please remember, if you don't have full movement of your neck because of the pain or the stiffness, don't do activities where you need full movement, for example driving or cycling, as you're putting yourself at risk and you're putting other people at risk. So that's a little about treatments, but what about prevention? How can you try and prevent non-specific neck pain from coming back? Let's quickly run through them, as I think it'll be quite useful for everyone to learn. So tip number 1, when you sit, always try and sit upright. upright. And I know it sounds a bit strange, but next time you sit down, just think to yourself, how are you sat? How are your shoulders placed? Are they rolled back? Are they rolled forward? And how is your neck placed? Because all of these, the posture, can make a massive difference on neck pain. And tip number 2, do you have a desk job? Are you sitting correctly? Is your monitor the right height? Is your seat the right height? Because all of these can make a massive difference. Now the good news is the NHS have a really useful article all about how to set up your desk properly, all about how to sit properly, which I mentioned in tip number 1. So if this applies to you, please check out that article. I will leave a link to it in the description below. And also, before anyone comments and says, this monitor is too low for you, I promise you it's not. This is a wide angle lens, and for some strange reason, this monitor looks like it's too low for me, but it is the correct height. Which moves us on nicely to tip number 3. Make sure your head is the same height as your body when you're sleeping. So remember the low pillow that we spoke about earlier? This can really help. Also, make sure you have a firm mattress. This has been shown to help as well. Make sure you don't sleep on your front. This doesn't help. And lastly, make sure you don't twist your neck when you're in bed. This is a habit that a lot of people do, but it's really not good. Thank you for watching this week's video. If you currently have neck pain or stiffness, I really hope my tips help you in this video. If you don't have neck pain and you're watching this video, well, thank you for watching anyway, and you are now a neck pain pro. So tell your friends, tell your family, tell your loved ones, tell everyone, because you're a neck pain pro. Always remember you're awesome, and I will see you next week. You've got to do this exercise. I mean, it does look a little funny, but I mean, that's too fast though. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.